Hello everyone, I am psychologist Fatu Sane and welcome to our health segment today where I will help you guys be able to understand mental health in a very simple way. We live in a time and era where we're seeing high levels of stress, increasing levels of depression among the masses, and increasing levels of suicide rate. The suicide rate is constantly increasing, and with this, the question on everyone's mind is what is really happening, and for us to be able to understand this, all the problems you're facing holistically, is to be able to understand the very important and crucial role our mental health plays in our day-to-day life. First of all, mental health covers three major areas. Mental health is more about your physical well-being, your social well-being, and your psychological well-being. And when we come to be able to start understanding your mental health and the major areas that it affects, I'll use a very simple model, which is the biopsychosocial model. First, I'll start with the biological factors. These are factors that may affect your mental health in different ways. First of all, genetics. When you come from a family with a history of mental illness, this increases the risk of you getting a mental illness. It does not necessarily mean that you will get a mental illness, but it heightens the risk factor. Secondly, use of drugs, substance abuse exacerbates or increases the risk of one getting a mental illness. Another thing is having a hormonal imbalance. Hormonal changes bring about change in mood, which can make someone feel very low at certain points of the year. These are all factors that are biological that affect your mental health. Secondly, the psychological factors. Psychological factors, these are factors that are within you, your thought process. How do you normally think about different situations in your life? How do your cognitive processes work? Are you a person that constantly sees negative in every solution? Are you a constant negative thinker? Are you a person who is a high self-critic? Are you a person who sticks with all the negative, or are you able to stick a balance in different things that happen in your life? Secondly, your personality traits. What are your traits? Are you a perfectionist, a person who needs things to go in a certain order, and when they don't go in that specific order, you totally lose it? Or are you a person who is very free, doesn't care about things, let things flow, which at some point affect you? And another thing is when it comes to your thought process, is how do you review the situations in your life, the things that happen in your life? How do you review them, and from what wing do you view them, or what window do you give the perspective of the things that happen in your life? Because in essence, we all experience things differently, and it's more of the perspective we give them in our brain. Thirdly, it's the social factors, the social aspects that really affect our mental health, the environment we live in, the type of people we interact with on a day-to-day basis. These are all general things that affect us. Do you live in an environment where you're constantly criticized, you constantly feel low, or in contrast, do you live in an environment where you're encouraged and you're able to thrive, or you have a balance of both? But these are all. What are your relationships like? Do you have relationships that constantly go about bickering, complaining, which lead to an endless argument? Or do you have relationships where it's okay to have the tough conversation? These are all things that come ahead and culminate in our day-to-day lives to affect our mental health in different ways, because simple events, simple talks or comments can lead to us constantly thinking, rethinking, and revisiting them to further cause other problems when it comes to our mental health. So this is a challenge to all of us to be able to look at mental health from a holistic perspective when it comes to our lives and know that each aspect contributes to our mental health.